Welcome to Obstetric and Gynecology Made Easy. In this video, we will explore thromboprophylaxis in pregnancy, discussing key risk factors for blood clots according to the Royal College guideline. We have three groups of risk factor: pre-existing risk factors in blue color, obstetric risk factors in red color, and transient risk factors in green colors. And we have mnemonic for them, thrombosis profile. Let's start. T letter stand for previous venous thromboembolism, except a single event related to major surgery, which means that the patient had multiple previous venous thromboembolism, one of them due to surgery. T stand for previous venous thromboembolism provoked by major surgery, which means the patient had single venous thromboembolism provoked by major surgery. H. Family history of unprovoked or estrogen-related venous thromboembolism in first degree relative. R. Risk factors for thrombophilia, known high risk and known low risk. O. Obesity with body mass index more than 30 or body mass index more than or equal 40. M. Multipara more than or equal 3. And M for medical disorder in a mnemonic shocked. S. Sickle cell disease or systemic lupus. H. Heart failure, and O for inflammatory bowel disease. O letter look like cut section in a bowel. C. Cancer. K. Kidney nephrotic syndrome, and E. Incisions, which refers to inflammatory polyarthritis, and D. Diabetes with nephropathy and IV drug user. B. Beyond 35 age. And O. Ovarian hyperstimulation syndrome, first trimester only. S for systemic infection, current systemic infection, and surgical procedure in pregnancy, like appendectomy. S. Skin, when we see gross varicose veins, and S for smoker. I. IVF and ERT, antenatal only. S. Stillbirth, C-section, elective C-section, and C-section in labor. BR, preeclampsia, preterm, before 37 weeks, and multiple pregnancy. BRO for prolonged labor, more than 24 hours. RO for rotational operative delivery or mid-cavity. B. Postpartum hemorrhage, more than one, when we lost more than 1 liter or need blood transfusion. HY for hyperemesis, dehydration, and L long duration traveling, more than 4 hours. Paraplegia, which refers to immobility. We have score system for risk factors according to Royal College guideline. 4, 3, 2, 1. We will use this sentence as a mnemonic. Oops, she shocked to see hospital. Each letters in the word oops receive a score of 4. O letter stand for ovarian hyperstimulation syndrome, and BS stand for previous venous thromboembolism except a single event related to major surgery. Score 3. Each letters in she shocked will receive a score of 3. S letter stand for surgical procedure in pregnancy and C-section in labor. H letter stand for hyperemesis, hospital admission, more than or equal 3 days, and high risk known for thrombophilia. And E for embolism, previous venous thromboembolism, provoked by major surgery. And we have medical disorders in shocked mnemonic. S for sickle cell disease and systemic lupus. H. Heart failure. O. Localized bowel. So O for inflammatory bowel disease. C for cancer, and K for kidney nephrotic syndrome. And E for incisions refers to inflammatory polyarthritis. And D for diabetes with nephropathy and IV drug user. Score 2 to C. TO letters for to obese, body mass index equal or more than 40, and C for C-section in labor. Score 1. Hospital. H. High risk thrombophilia. O. Obesity, operative delivery, mid-cavity or rotational. S. Systemic infection, current systemic infection, and skin when we see varicose vein. S. Smoker, stillbirth, and C-section, elective C-section. B. Parity more than 3, preeclampsia, preterm before 37 weeks, prolonged labor, and postpartum hemorrhage. I for IVF and immobility. T. Twins, multi-gestational. A for age more than 35, and L. low-risk thrombophilia. According to the risk assessment scoring system, the evaluation begins during the first antenatal visit. Score 1 or 2. Mobilization and hydration are recommended, no prophylaxis needed. If total score 3 antenatally, consider thromboprophylaxis from 25 weeks. We have 3 score and 20-week mean third trimester. So if we have score 3 antenatal, we will start from the third 3 for 3. And if total score more than or equal 4 antenatal, consider thromboprophylaxis from the first trimester. Number 4 start with F letter, and first trimester start with F letter. So F for F and 3 for 3. If total score 3 antenatal or total score more than or equal 4 antenatal, continue thromboprophylaxis until 6 weeks postpartum if risk factor persists. If the patient admitted to hospital antenatally, consider thromboprophylaxis. And postnatal. Score 0-1, mobilization and hydration are recommended, no prophylaxis needed. If total score more than or equal to postnatally, consider thromboprophylaxis for at least 10 days. 3 point postnatal low molecular weight for at least 10 days, extend to 6 weeks postpartum. If score more than or equal 4 point, postnatal low molecular weight considered and extend to 6 week postpartum. Score 2 and score 3. Number 2 start with T letter and number 3 start with 3 letter, and we have 10 days. Number 10 start with T letter. So when score we have 2 point or 3 point, consider thromboprophylaxis for at least 10 days. So we have 3 T letters. If prolonged admission more than or equal 3 days or readmission to hospital within the puerperium, consider thromboprophylaxis. So we have 2 mnemonic for antenatal or postnatal thromboprophylaxis. I hope this helps. Please don't forget to like and share.